Well, good afternoon. What I'm trying to do here is give you a demonstration of what we're trying to create when we're doing guides and placement of implants. I'm trying to do is create a background so that we can have the implants placed where the teeth are going to be. What's important when you deal with these things is that we design the tooth positions first before we sit down and decide we're going to put implants in. So what we have done is a wax up that shows up where the teeth are, and then we merge all these files together and create a position for where the implants are going to be based on the restorative. It's analogous to building a house. What do we mean by that? We don't build a foundation for a house and decide to build a house around the foundation. What we do is we design the house first in a blueprint, and then we go ahead and we design the house, the foundation to match the house. Same thing should be done here when we deal with implants. So what you see here is we've gone ahead and we've placed all the implants in position. Then I place abutments to make sure that they're in a position where they can be restored by the restorative dentist, and they're in positions where the teeth are going to fit. I'm not going to go through how you merge files or how to, cut models and all that, because that's an entirely different set of circumstances. But what's important is that people understand what we're trying to create here. And the goal is to create implants that can be restored within an envelope or a size that matches where the teeth are going to be. So what I'm going to do here real briefly is turn off the guide that shows where to wax up, where the teeth were planned to be. This is where the teeth currently are, and all these teeth in this particular case are going to be removed. So we definitely need to do that in this case. This is just showing you where the model is that we are going to use, and this shows you where the bone is, and you can see a picture of that, and that's just a bony model. So I can make a guide to the bony model, and I can make a guide to the soft tissue also, and you can see how the implants are positioned and where the abutments end up at. So let's go into another view here, and we go ahead and I show you the bony model, which is actually a CT scan of where the bone really is. All right? So all this stuff needs to fit together in one big happy position so that everything can be followed. And you're just seeing that lined up here. And I'm just going to turn the views on so you can see them in the objects, and we should see the scan of the model, and then we should see a scan of the outline of the model outline too. And you're just seeing the outline of the bone as it overlies over top of the bone of the CT scan, so that everything is lined up and measured correctly across. Basically, accuracy is very important here because we want to apply and use points of reference that are accurate for us. I can make a bony model, make a guide for bone, I can make a guide for teeth, and I can make a guide for soft tissue alone. But the goal here is to make something that is workable, repeatable, and extremely accurate so we get exactly what we want. So the first set of thing I do is I place all the implants, I design everything, and I need to turn some implants off so that I can make a guide that's going to fit over top of teeth here this time, so I can get the first few implants in the correct position. So I'm going to turn off the two back implants, off their abutments, and again the same thing here, and back on off, and off with the abutment also. So now I'm ready to create a guide. So what I'm going to do is I'm going to create a guide that's going to fit this particular situation. It doesn't matter if we have to cut on teeth a little bit in order to place implants, because these teeth are going to come out. Okay. So now we're going to create guides, and we need to draw curves and make sure that things are accurate so that they sit in the correct position when we're done. So what I'm going to do now is just draw some curves in here. I'll be able to adjust this later if we don't like positions. And this is going to be what's called a tooth-borne guide. Basically, it sits on the teeth, and I can place the first set of implants to the right depth as everything has been lined up in the first place, so it will be accurate. And then I'm going to edit curve. And I can move things around. I just put this up here so you can see what I can do and not do and make this thing work for the patient. And if we don't like what things are, I can always redraw the curve. And there it is. This is coming up. Wherever I set these is where the guide's going to be cut to. And it just takes a couple of minutes, and you want to make sure that things are where you want them. The softwares are all set up to take care of undercuts and things and make things that will actually allow it to fit on the teeth. I don't need the palate, I just need the teeth in a case like this. And again, we're just moving things along. And you don't need to be that far away from the tooth. I mean, we can actually put it on the tooth and be just fine. And this will work. And now I'm going to say create surgical guide. And it takes a minute or two. It's kind of a large calculation. There we go. We're going to say guide. We need to make sure we got the right names of the patients, and I'm not going to do that right now because I don't want to show you the names of the patients. But this is how a guide is made, and this will be very, very accurate when it comes to positioning of the anterior implants. This allows me to make this set of guides and save this, and then I make a second set of guides, and this time it will be based on the bone and not on the soft tissue. So I'm going to turn this stuff off. Go to surfaces. I need that off. And I need to go to implants, and I need to turn all these off. Turn these off. And turn the implants off. And I just need to print this guide. As I told you over here, we're going to put these collars in, but we're going to go ahead and, glue this in place later on, the collars, and remove part of the tooth in the surgical procedure. It does not matter. The teeth are coming out. This is for a patient who's going to become totally edentulous. These teeth are not salvageable. You got to remember to think a little bit outside the box. You just need to make sure that things are accurate. That's the single most important thing, that things go where they're supposed to go. Right? So the next step would be to put the same implants in. So I'm going to turn this off so I can give you a good idea what we're talking about. I'm going to turn off the guide itself. And now if I'm doing the same thing, I want to do the maxilla. I want to activate all the implants again. I turn them back on so you can see where they are, where they're sitting. I got to put these collars back in. You want to see where the abutments are sitting. These things are very accurate as they were all merged together. And now I can repeat the same performance and make another guide to this surface, all right? Following the same program. But the whole idea here is I can also do a bone reduction guide. As you can see right here, this bone reduction guide, which is going to fit over top of the bone. And then we can reduce the bone so that these other guides are going to fit. And then we put this bone in here for the final implants. And I'm going to lock the first 3 implants I made with the first guide that you just saw. All the implant positions are already predetermined, so everything's just being shut on and off. You've already designed it ahead of time. So these 3 will be locked into place. Then I can drill the last 2, and they'll be very accurate too. I already know the angulation of the abutments I'm going to use, the positions I'm going to have all the implants in, and this will be extremely accurate. And to help the prosthetic side so that the teeth will fit inside the mouth and make sure that they can also fit on an articulator that is already mounted, I can now duplicate this, put this inside here, put the stay plate on top of here, and mount this case just like it was inside of there. I even created little notches in the back so that you can mount them. So cut this, print out both the teeth and the model, and then we go ahead and we can position, make another one that sits on top of here, on top of that one other model, which is a cut model. That's usually what you'll see right here. Let's go to surfaces, and I'll turn off this one so you can see, and now you have basically a cut model, and that too will be accurate, and I can print that up, and this is what you see right here. And then I print up a guide that fits over top of this the same way the other one was done. And now we can have the positions of the implant accurate, we can have the models mounted, and now I have the positions so that the bridge work can be made ahead of time and made accurately on a mounting, as dentists all know how to do very, very well, instead of trying to do it on a situation where we're trying to mount it artificially inside of a program. Sometimes you need to go directly to the patient and get the accuracy of the bite registrations so I know where things fit. I've used the basic principles of making sure that the teeth are waxed up in exactly the right positions that you want them in the first place. Make sure that the patient is happy with where their teeth are. And then we come back and we place the implants to match those teeth. But that requires planning ahead and making sure that everything fits, and that the doctors and everybody has a chance to be able to position, and everybody gets a chance to review these cases prior to them being done, so that we can do the utmost in making sure that everybody gets the best results they can possibly get in a very accurate method that is very repeatable and very easy to actually accomplish. If you have any questions, I'll be more than happy to answer them for you, and I can certainly give much longer lecture on this particular topic, but I'm just trying to give you basically the condensed version of what needs to be done here. Thank you very much. This concludes this part of the operation.